Hello, my name is Heidi Siddle. We are going to share the findings of research conducted during my NIHR fellowship, which has funded the development of the Could It Be RA COBRA tool website, which Anna will tell you more about later. Members of the NIHR Leeds Biomedical Research Centre Patient and Public Involvement Group helped me to develop my research plan back in 2018 and have continued to provide advice, input and support as members of my project advisory group. Leah will now tell you about her personal experience of developing rheumatoid arthritis.
Hi, I'm Leah and I got involved partway through this project as a patient and public involvement representative member of the project advisory group. I have rheumatoid arthritis, which is a lifelong condition that occurs when the body's immune system attacks joints by mistake. This makes joints sore, swollen and stiff and can damage joints. The best way to prevent problems from rheumatoid arthritis is to diagnose and treat it early, but unfortunately there were lots of delays with diagnosing my rheumatoid arthritis. I saw quite a few different GPs, and things that eventually led to the diagnosis was that one of them used the anti-CCP blood test. When that was positive, they referred me to the specialist rheumatology department at Chapel Allerton Hospital. That's where I received further tests and monitoring and ended up being diagnosed with rheumatoid arthritis. So I think that if there's a way to help clinicians know when to use the anti-CCP test and speed up the process for diagnosing rheumatoid arthritis, it would be very useful.
Thank you, Leah. As many of you will know, this is not just Leah's experience. Patients who go on to develop rheumatoid arthritis typically see their GP on 4 occasions between developing symptoms and seeing a rheumatologist. The time from developing symptoms to getting a diagnosis is about 9 months. This project aims to help us identify people in primary care who have new joint symptoms and might be at risk of developing rheumatoid arthritis through using a blood test called anti-CCP. It detects antibodies that are typically present before someone develops swelling in their joints, also known as synovitis, which is the main clinical sign of rheumatoid arthritis. In study 1, we used a large set of data of people who had the blood test in primary care to develop a checklist known as a prediction model to help us decide who is likely to test positive for anti-CCP and therefore should have the test. In study 2, we have been working with the health economist to explore if using the anti-CCP model will reduce healthcare costs, which might be, for example, reducing the number of appointments before someone is referred to rheumatology. And the final study, which Anna will talk about, has been to develop a new tool, the COBRA tool, which includes the anti-CCP prediction model, the checklist. This part of the study had 3 stages. In stage 1, we interviewed 8 GPs and 8 first contact practitioners, which were physiotherapists by background, and we developed a draft list of possible items to include in the tool. In stage 2, we carried out 2 workshops with 3 GPs and 5 first contact practitioners, and that helped us to decide which items we needed to include in the tool. And finally, in stage 3, we tested the tool, the draft tool, with several primary care clinicians, and we used their feedback to improve it. Thanks, Anna.
So as Heidi mentioned, the first phase in our study involved interviews with 8 GPs and 8 first contact practitioners to draft a list of possible items to include in the tool. To support that, we showed the participants a suggested tool for helping clinicians decide if a patient should have the anti-CCP blood test, and that's shown here. So this would be for clinicians to use with patients who have joint pain but who don't have any of the usual symptoms of rheumatoid arthritis, like joint swelling. And the idea is that clinicians would ask patients about all the points shown here to calculate a total score. Then if the total score is equal to or greater than a set threshold, the patient should be sent for an anti-CCP test. So we reviewed the interview findings to develop themes, which are sort of the key take-home messages from across the interviews. Our first theme is differences in current practice, as we found there were lots of differences in how clinicians identify and refer patients with suspected rheumatoid arthritis. And this is a sort of overarching theme because it links closely with the other themes. Our second theme is social factors across the whole healthcare system, as we found it would be important for clinicians working in various settings like GP surgeries and specialist arthritis services, all to support the use of the tool. Our third theme is weighing up possible benefits and risks, as for clinicians to use the tool, they would need to believe its benefits outweigh its risks. Then our final theme is access to and usability of the tool, as the clinicians emphasise the importance of making sure the tool is easy to access and use. So as well as developing these themes, we use the stage 1 findings to develop a list of possible items for the tool. Then in stage 2, we held workshops with 3 GPs and 5 first contact practitioners to prioritise the items. As you can see, 2 items are rated as must have, 2 as should have, and 5 as could have. And for the must have and should have items, we also discussed how to design them, such as what format we should provide the decision tool in. We then worked with a web development company called Frank and our project advisory group to develop an early version of the tool, which, as you'll have gathered, we decided to call the Could It Be RA tool, or COBRA tool for short. So this is a screenshot of the home page of the initial version of our COBRA tool. You can see from the tabs at the top that as well as the home page, we included a few other pages, including a page with evidence related to the tool, a page with points for clinicians to discuss with patients, and a page with resources for patients who test positive for the anti-CCP blood test. So then in phase 3, we asked 7 GPs and 3 first contact practitioners and 2 advanced nurse practitioners to try using the COBRA tool during an interview. As you can see from this quote, most participants liked the tool. And this quote here is saying, I think it's really good, really clear, and the actual tool itself is really quick to use. The participants generally felt the tool could have benefits, such as helping clinicians make decisions and reducing unnecessary use of the anti-CCP test. However, there was one participant who had a very negative view of the COBRA tool, and a key reason for this was that they were concerned about the overall idea of identifying people at risk of rheumatoid arthritis and how they would be managed. We have a quote here saying, I don't want a tool for something to find something early that I can't make a good difference to. And there certainly does need to be more research into how to manage people at risk of rheumatoid arthritis, so Heidi's going to discuss some points about that shortly. So we used the feedback on the COBRA tool to gradually improve it. So we just wanted to provide a quick example of that. You can see here we've got a screenshot of the early version of the COBRA tool taken on a mobile phone. We found a key issue was that clinicians might use the tool with patients with joint swelling, and that's not what it's intended for, and it's a potential safety concern because if clinicians use the tool with patients with joint swelling and it suggests the anti-CCP test is not needed, it might give the clinician false reassurance that they don't need to do anything. So we decided to add a red alert banner informing clinicians that if the patient has joint swelling, they should be referred to specialist services straight away, and clinicians shouldn't complete the COBRA tool. But we found some clinicians still seem to be thinking they might use the tool with patients with joint swelling. So we then added a screening question at the top of the tool to directly ask clinicians if their patient has joint swelling. And if they selected yes, we brought up an alert banner. That did seem to be helpful for the final 2 interviews, but obviously looking at the tool in an interview is very different to clinicians using it in practice. So further research is needed to explore that.
Thank you, Anna. And as Anna said, as with all research, it generates new questions, and therefore we are developing new applications for research funding. With respect to the COBRA tool, we want to explore how joint specialists, the rheumatologists, identify and manage people at risk of rheumatoid arthritis. We think it's important to develop some recommendations for referring and managing people who are at risk of rheumatoid arthritis so that GPs and rheumatologists know what to do. And finally, with all this information, we hope that we'll be able to further improve and finalise the COBRA tool for future testing. Beyond this scope of work, we want to set some priorities and define a strategy for monitoring those people who are at risk of rheumatoid arthritis. It's likely that not everybody will need to be monitored, and therefore it's important to understand who should be and whether they can be managed by their GP or by a rheumatologist in secondary care in the hospital. And finally, we want to put a pathway of care in place for people at risk of rheumatoid arthritis and find out if this is actually helpful in preventing or delaying the onset of rheumatoid arthritis. There are many people we need to thank who have contributed to this project, and they're all listed here, but mainly we want to thank our patient and public advisory members who have contributed to the project advisory group. Thank you. And lastly, to send you home with a few take-home messages. Delays in identifying rheumatoid arthritis are common in primary care settings like GP surgeries. We think that using a decision tool to target anti-CCP testing could help identify people who are at risk of rheumatoid arthritis much earlier. And a key step now is to put the COBRA tool into practice and find out if it is helpful. Thank you very much for listening.